I'm an orthopedic foot and ankle specialist. That means I did medical school, which did at Georgetown School of Medicine in Washington, D.C. And then I did a fellowship in foot and ankle orthopedic surgery, which was at Baylor Medical Center in Dallas. In between there, I did my orthopedic residency, which was at the University of Kentucky. And then I was in active duty Air Force as an orthopedic surgeon for 4 years in Shreveport, Louisiana. I grew up on the east side of Cleveland, in Cleveland Heights. Through my education, I've been all over, and on that whole swing, I started to feel like I wanted to come back to where we have 4 seasons and the trees turn in the fall, and it felt more normal and kind of natural to me. So we looked for an opportunity in this area where we still have some family, and came back in 2008. As an orthopedic foot and ankle surgeon, there are some things that I do that really almost nobody else does. Those are some really specialized surgeries around the ankle and foot. And that ranges from, sports injuries of the ankle and foot, trauma, diabetic foot care, sometimes even ulceration, treatment or treatment of diabetic complications. I take care of everything from bunions, hammer toes, arthritis of the foot, and then some things that are very special that I do in ankle arthritis. There has been a development over the past several years or so to ankle replacement instead of ankle surgeries that take away motion. Something that's been worked on for many years but has become more mainstream and kind of perfected more over the last 15 or 20 years. And I've been doing it here in Canton since I got here 15 years ago. So we replace ankles just like we replace knees and hips and other joints. And I'm one of the only people that in this area that does that, and certainly the one who's done it the most. I have some overlap with some of my other partners, and one of those things is that I take care of knee problems as well. Anything from sports knee injuries all the way to knee replacements for arthritis. Over time, the ankle replacements have gotten better and better. We anticipate that they'll last somewhere around 15 to 20 years. I have ones that I've done 15 years ago that are still going strong. Over time, the advances in ankle joint replacement have had more to do with having the parts last longer, having the surgery able to be done in a shorter period of time and more accurately. Any kind of painful problem or deformity of the foot or ankle can really cause a quality of life problem. And there are a lot of options, including non-surgical ones and surgical ones when it's appropriate, for taking care of many of these problems. They're not problems that have no answer, and it can range from trying to find the right shoe and insole combination, sometimes custom-made insoles or orthotics. It can involve therapy or home exercises, medications, sometimes shots. There's really no need to live in pain without having an evaluation to really look at the options. One of the great things about being a foot and ankle orthopedic surgeon is that I get to see people at all different stages of their life. I see children, I see teenagers, young adults, older folks, and everything in between. One of the really rewarding things is that I sometimes take care of many different members of the same family. I'll have the grandparent, then they send their adult child or their adult offspring and their kids, and so I really develop relationships with groups of people, whereas if I were only taking care of older patients, I wouldn't really have that relationship. And also, there are many of the problems that I treat that there are great options for treatment. So a lot of times people come in with a really bad problem, and through treatment, whether it's non-surgical care or surgery, we're really able to get them back doing the things that they really want to do, and that's really gratifying.